Is your period trying to tell you something? Let's decode what it's really trying to tell you about your health. Periods can be a reflection of your health in many ways, from hormonal imbalances, metabolic issues, or even psychological stress. Sometimes they can signal something systemic, maybe even an autoimmune disorder. Before you proceed in this video, you need to understand that menstrual cycles can vary wildly in duration, from 21 to 35 days, and the menses, that is the actual flow, averages about 5 days, but can range from 3 to 7. The volume of blood loss is generally determined by the amount and type of feminine products you use during that time. The heavier your period, the more you'll use. Then there's also the type of blood, consistency, clots, etc. All these variations don't necessarily mean something is wrong, but you do need to understand your flow, track it, track changes, and talk to a medical professional just in case. Welcome to Autonomy Health. Let's break this down. Polycystic ovarian syndrome, or PCOS, is a hormonal condition characterized mainly by irregular periods, hormonal imbalance, and imaging, often MRI, showing cysts on the ovaries. Typically, any two of these are enough for a diagnosis. In PCOS, one of the biggest issues is elevated male hormones, called androgens, which disrupt the menstrual cycle. Insulin resistance is also common, basically overlapping with type 2 diabetes. Here's the frustrating part. The symptoms of PCOS often make the condition worse. Most cases are found in overweight women, and insulin resistance promotes further weight gain, creating a vicious cycle. So in most cases, doctors don't cure PCOS. They manage the symptoms, usually through effective weight management. When it comes to periods, irregularity is extremely common. Some women go months without a period, others bleed for weeks, and some even have multiple flows in 1 month. Now, let's talk about thyroid issues. The thyroid gland is a butterfly-shaped gland at the front of your neck. Despite its size, it controls most of your metabolic processes, from heart rate to digestion. If it's overactive, hyperthyroidism, you'll see things like increased heart rate and diarrhea. Hyper means over. If it's underactive, hypothyroidism, you'll see low heart rate and constipation. But for menstrual cycles, both can cause irregularity. Hypothyroidism often leads to weight gain, and excess weight, especially rapid gain, can overstimulate the ovaries unpredictably. Hyperthyroidism may cause excessive weight loss. Women generally need at least 15% body fat to maintain menstrual cycles. Lose too much weight, whether from thyroid disease, overtraining, or eating disorders, and estrogen production shuts down. No estrogen, no cycle. Now, let's talk about stress, the silent wrecking ball. When you're stressed, your body releases cortisol. Cortisol increases production of sex hormone binding globulin, or SHBG, which binds estrogen and progesterone. Here's the problem. Your menstrual cycle relies on precise fluctuations of these hormones. When SHBG binds estrogen at the wrong time, your body behaves as if estrogen is missing. An estrogen surge is required for ovulation. Stress delays that surge. Progesterone maintains the uterine lining, and a false drop caused by elevated SHBG can trigger bleeding earlier than expected. And no, please don't try to time this instead of using birth control. Biology does not respect calendars. Bottom line, stress disrupts cycles. Period. Birth control pills are next. They're often prescribed to regulate cycles, including in PCOS, but stopping them can cause the opposite effect. When you take birth control, you add hormones. Your body responds by increasing SHBG to prevent hormonal overload. When you stop the pill, SHBG stays high, binding whatever estrogen and progesterone you still have. This can cause irregular periods, and yes, it can tank libido. Estrogen drives sex drive. Less free estrogen, less desire. Same mechanism, same result. This is also why stressed women often experience low libido. Weight management is crucial for reproductive health. Extreme changes, up or down, disrupt hormone signaling. Estrogen comes in three forms: estrone, from fat; estradiol, from ovaries; estriol, from pregnancy. Estrone from fat stimulates the ovaries to produce estradiol. Without enough body fat, estrone drops, ovarian stimulation drops, and periods stop. Weight fluctuations cause hormone fluctuations, which cause cycle fluctuations. Let's talk heavy bleeding. If your periods are heavy, talk to your doctor, not just because of the cause, but because heavy bleeding can lead to anemia. Women lose iron monthly. Men don't. That's why women tend to have lower hemoglobin levels. Heavy bleeding may mean higher volume, longer duration, sometimes up to 10 days. Common causes include uterine fibroids, more common in smokers, and endometriosis. Endometriosis occurs when uterine tissue grows outside the uterus. The wild part? That tissue still behaves like it's in the uterus. It bleeds, it reacts, it causes pain, in places never designed to contract. The more tissue that relocates, the heavier the bleeding and the worse the pain. It's complicated, but that's the idea. Absence of periods is called amenorrhea. Common causes include being underweight, overtraining, and rapid weight loss, especially in teens through 30s. In your late 30s or early 40s, it could signal early menopause. Before menopause comes perimenopause, months without periods, then surprise returns. After 12 months without a period, that's menopause. Menarche is the beginning. Menopause is the end. Missed period, healthy weight, not overtraining in your 20s or 30s? You're probably pregnant. No period is always a signal. Never accept no period, no problem. Things can end badly. So here's what healthy periods look like. Cycle length, 21 to 35 days. Bleeding, 2 to 7 days. Predictable timing. Pain. Discomfort is normal. Debilitating pain is not. Being told just deal with it is not medical advice. The cause could be dehydration or endometriosis. Either way, see a professional. Finally, track color, texture, and flow. Know you're normal, so you notice when it changes. So yes, your period is more than an inconvenience. It's diagnostic. If something changes, don't ignore it. Until next time, thanks for watching.